Our project looked at the perception of prevalence of peripheral arterial disease as thought of by medical personnel in Nepal by surveying people who were affiliated with Kathmandu University as well as Dhulikhel Hospital, courtesy of Dr. Robin in Nepal. Here is the complete poster as submitted to MSSRP, and I'll break it down in the next couple slides so that we can talk about it. Peripheral arterial disease is a condition in which arteries are blocked, excluding the brain and heart. However, it does increase the risk for these patients to have a myocardial infarction and stroke or amputation. So it has complications associated with it. And the prevalence right now is unknown in Nepal, although in India, neighboring the country, it's 26.7%, which is pretty high. And so it's possible that this lack of diagnosis of peripheral arterial disease in Nepal could be due to inadequate training of the medical personnel. And we aimed to see what the prevalence was in order to hopefully eliminate the fact that these patients are at this increased risk of MI and stroke, and hopefully be able to decrease the amount of disability and death associated with peripheral arterial disease if we could target the understanding of the disease by the medical personnel. A 12-question survey was emailed out from June to July 27th of 2020, and respondents included medical students, nursing students, intern doctors, paramedics, Bachelor of Dentistry, as well as physiotherapy students. All of the students and interns rate their perception on the prevalence of PAD in Nepal, as well as their understanding of diagnosis, as well as if they had had a lecture or clinical exposure to a patient to base their understanding of diagnosis on. So although our goals were to quantify the perception of the prevalence of peripheral arterial disease in Nepal, the data kind of ended up taking us in a different direction as we were able to identify some possible gaps in the education of medical students specifically. However, across all respondents, the fact that many of them had had a dedicated lecture on peripheral arterial disease but still did not feel comfortable in ordering workup for PAD, or they did not feel that they had been adequately trained to diagnose PAD. So this table kind of summarizes that data for us. So we have students who had received a dedicated lecture on peripheral arterial disease and their comfort level with both diagnosing and ordering a workup for these patients. And the students in general, even with a dedicated lecture, are falling under 17% and feeling comfortable with these things. Meanwhile, there were only 4 students who had cared for a patient and not received a lecture, so the data is not the most statistically significant. However, you can see that they are not feeling comfortable as well. However, the numbers do increase when a student has had both dedicated lecture and has cared for a PAD patient. Their understanding of the disease, ability to diagnose, as well as the familiarity of ordering the workup really increases, leading us to believe that if they've done both, I'll talk about this in the discussion on the next slide, but if they have both, their understanding really increases and allows their patient care to probably be better as well. So the majority of students and trainees that responded, 67%, did not feel adequate in their ability to diagnose peripheral arterial disease, even though they reported that they have received a dedicated lecture on it. However, when we looked at the data of just the intern doctors, 93% were familiar with the workup and diagnosing modalities, while 47% felt able to diagnose. So this indicated to us that at some point, the intern doctors are learning this in their education or their career, but it's not in medical school based on looking at medical student data alone, and overall the students, even with the lecture, are not understanding the diagnosis of the disease. And then, as stated in the previous table, those who had both a lecture and have cared for a patient had the best understanding of both modalities and diagnosis, leading us to believe that the combination is the best form of education. In order to increase the quality of care for these peripheral arterial disease patients, as well as decrease the risk, especially for myocardial infarction and stroke, we know that these patients need to be able to have their diagnosis made by the medical personnel in Nepal. So we suggest that the manner in which it is taught needs to be improved in order to improve this diagnosis and treatment. So we think that the incorporation of exposing medical trainees to patients at the time of lecture may demonstrate needed evaluation such as physical history, or physical and history, and benefit the overall population health. So with Dr. Robin, we attempt to implement new lecture techniques and at Kathmandu University, and then redistribute the survey to see after these are added how things change. And a special thanks to the Dr. Elaine Kohler, Summer Academy of Global Health Research, and the Global Health Office at the Medical College of Wisconsin.